Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle Live in studio. I'd love to take your phone calls on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, here's your opportunity. Here's something that we can do without drugs, without surgery. Call me now, 888-630-9625. That's 888-630-9625. It's great to be back. I got stuck last week in Dallas, Texas, with all the snow and the nastiness we had up here. My plane wouldn't leave, and then Dallas ended up with an ice storm, and it was like, if you remember what Atlanta looked like a few weeks ago, that's what Dallas looked like. So we got stuck until about Tuesday and finally got back into Washington. The good news is it's getting warmer now, and we're supposed to continue this trend at least for a while. Hopefully spring is here, and now with daylight savings time, we're, kind of anticipating a better and brighter springtime and summer and so forth. So enjoy it while you got it, as they say. So 888-630-9625. Have a lot of things I want to talk to you about today, and I also want to re-invite you. Last week, we were supposed to have, and we did, Dr. Lamb's program on arthritis, but because of the inclement weather and so forth, many of you were afraid to come out and to travel any distance. So, because of that, we are going to hold it again this Wednesday evening at 7:30 at the Roselle Center for Healing, March the 12th. So if you have a problem with arthritis, we'll talk a little bit about that today, but I have a lot of other things I want to talk to you about as well. Please join us, 7:30 this Wednesday, March the 12th, at the Roselle Center for Healing in Fairfax. We're right off the National Capital Beltway, literally probably a third of a mile, and we're in the Red Cross building. Love to have you. All we require from you is a reservation. So if you give us a call at 703-698-7117, that's 703-698-7117, and tell my staff that you'd like to attend Dr. Lamb's presentation this Wednesday evening on arthritis. If you've had problems with your joints not working, your doctor's told you got to stay on either Vioxx or Bextrar, Celebrex, or any of these things, or even just putting you on aspirin forever, there's another way. There really is. There's ways of getting around this because the side effects of these medications are awful. They're really, really ridiculous. NSAIDs, for example, any nonsteroidal anti-inflammatory drugs, that includes aspirin, is the most commonly prescribed product for this, and you can get them over the counter, and you think, well, they're not a big deal, and they're used for all kinds of things, from headaches to muscle aches and fevers, and it goes on, right? So here's the problem. NSAIDs reduce joint inflammation, and they do that by blocking something called prostaglandins, and it decreases the triggering mechanism for pain and inflammation and cramping and fever and so forth. The biggest problem with any of these things, whether it's NSAIDs, is the risk. There was an article, a research article, that came out in the United Kingdom and says that people who are on NSAIDs have a much greater risk. Now, we're including aspirin here, much greater risk of heart attack and stroke and peripheral vascular disease. And this is not something that you just set aside. And then if you compound it and you're on high blood pressure medications, or you're on cholesterol medications, what we call statins, or you're a diabetic, or you're a smoker, you really dramatically increase your risk of all kinds of problems. Not okay. It's not good. And as I've said many times, the biggest portion of our population that is the greatest risk are older folks. Why? Because they don't do the data on you like they do everybody else. We already know they're bad news. But guess what? Guess what happens? When you increase that with age and, all the other medications that you're on, and then you end up dead because of cardiovascular failure, they say, well, you died of old age. It's not necessary. There's so many other things that you can do, but unfortunately in the medical community, the treatment of choice are steroids or NSAIDs or sulfamides and sometimes even antibiotics. It's not okay. You have to look at the body and see what it's doing. Arthritis is a reaction. It's an uncontrolled reaction due to environment, due to injury, due to structural maladaptation, misalignment. And you have to ask the question, why is it? So this Wednesday evening, we're going to turn all that around for you. Join us, 7:30, March the 12th. Dr. Lamp is like so much information. People say that, you have to sit there and you have to tape record them and write them down and all of that. But please show up. 7:30, Wednesday, March the 12th, our office. Love to have you. And we'll do what we can to help you get off your medications and tell you what you need to do and what's possible, what's not possible. Great night, 7:30 p.m., 703-698-7117. Several subjects I want to talk to you about today. I'm going to talk a little bit about frankenfoods, we've been talking about that recently, GMO-modified foods, but also I want to get into thyroid problems, and we'll see what kind of time we have, but I want to answer your questions as well. Let's talk about thyroid first and toxins, environmental toxins, and what happens. You've heard me, deal with this from time to time, but it's so important because of the fact that there's estimates that 35 to 37% of all people that walk into doctors' offices have something called Hashimoto's thyroiditis, which is an autoimmune inflammatory reaction of the thyroid gland and a shutdown of other systems because of that. But in addition to that, the people who are diagnosed with thyroid problems, they're saying up to 65 to 67% of you have a Hashimoto's thyroiditis that can be easily controlled. There's things that can be done from the natural community, not just being put on drugs. In thyroid, there's something called an HPTA axis, and in this situation, we're going to call it HPAT axis, hypothalamus, pituitary, adrenal, thyroid. And what does that mean, and what does it have to do with anything? Well, your adrenal glands, let's start out with those little fight-flight saviors of ours. They sit on top of your kidneys, small little ductless glands, and they put out your adrenaline. We call them today norepinephrine and epinephrine. They put out blood pressure regulating hormones. They put out blood sugar regulating hormones. They help your heart work the way it's supposed to. They decrease inflammation. They do all kinds of things. Without them, you're not going to last too long. You got to have these guys. But they also trigger the centers of the brain called the hypothalamus and the pituitary to work. The hypothalamus, if you look at the hypothalamus like a conductor, he's telling everybody what to do. Helps regulate your sensations in your body, your heat regulation with something else called the hippocampus and so forth. But there's a disruption of that whole mechanism when your body is stressed, and stressed from either chronic pain patterns or biochemical imbalance. The things that you shouldn't be eating, sugars and sodas and coffee and black teas and fast foods and fried foods and alcohol and gluten and additives and preservatives and yada, yada, yada goes on. You know my mantra, right? So when you're exposed to those things, you have a problem, and also constant emotional stress. So we're talking about this necessary HPAT axis meaning, shunt, one hits the other, hits the other, hits the other. And, we have things that affect them. Now, there's something called polychlorinated biphenyls, or PCBs, and these polybrominated diphenyl esters, PBDEs. Now, guess what? I don't expect you to remember this stuff, but you heard it once. You heard it here. And so subsequently, I just want you to know that there's these things that are out there that actually resemble thyroid hormone in their primary chemical structure. They look like it to your body. So they go in, and what they do is they cause a disruption of what we call the receptors, the body, the things that hook onto your thyroid hormone, and they begin to cause problems in the development not only of a hypothyroid, but they actually can begin to cause problems like tumors and, way down the time, even cancers. But it appears that these endocrine disrupting chemicals, these PCBs and these PBDEs, they have different levels of interference within this HPTA axis that we talked about. So the interference that we're talking about is not the classical mindset that medicine looks at. And I think we got to get down to basics and really understand the normal physiology of how the body works. Is it possible that one compound may affect several other levels of this HPTA axis? The simple deduction is, yeah, absolutely, it does that. But we need to understand it so we can fix it. Because otherwise you end up with goiters, the big lump in the front of your throat. You end up with things that shut down estrogen. It's called an anti-estrogenic effect. And ladies, this is really important for you. And because these PCBs and these PBDEs, what happens is they interrupt the estrogen receptor, the binding of your hormone, and subsequently you kind of get old faster and you don't feel good and your libido goes out the window and so forth. So what I want to do is I want to get into a little bit how this happens, because when this HPAT axis is disrupted, your body begins to not work the way it's supposed to. You feel bad, you're tired, you're hurt all over. The nervous system is affected, and sometimes the nervous system affects this directly. So to understand that whole interrelationship, and guys, listen, if libido goes out the door and your testosterone level is crashing, this is directly related to all the things that cause that to take place. There's only 3 things that cause anything. Remember that. One is injury to the spine. The nervous system starts with the brain and the spinal cord and the 31 pairs of nerves that come off the spine. And they do something very interesting if you've ever looked at a textbook of anatomy. As the nerves come out, they divide. One branch goes inside the body and has this, what we call somatovisceral reflex. Somato meaning coming from the body, visceral meaning the organ systems inside. And they also have this visceral somatoreflex. That means when the organ systems are messed up because of inflammation, wrong diet, exposures, and so forth, toxins, things that you eat, they're going to affect the soma, the body, and there's this back and forth mechanism. Pretty soon you don't know which came first, the chicken or the egg, but you got to find out to be able to fix it. So as we go through and we talk about this primary situation called the thyroid gland, but we have to understand this HPAT axis, hypothalamus, pituitary, adrenal, thyroid. They all work together. Without understanding that, you can't fix anything. And then what you do is you doctor up the mechanism by just giving drugs. That's all. You get on Synthroid, you get levothyroxine, or any of the other artificial drugs, and you influence the thyroid directly instead of influencing the mechanism that's causing the thyroid not to work the way it's supposed to work. Does that make sense to you? So when you go in, your doc says, here, take Synthroid, and it's an artificial form of T4, and that T4 now has to be converted to T3, which is the active hormone. But here's the catch on that, too, and we're going to talk about frankenfoods later on. If you are sensitive, allergic to corn in any way, you can't take Synthroid. It's a problem, because if you look it up, it has that relationship to corn in an extract. So guess what, folks? Sometimes to fix the problem, you make it worse, because now if you're allergic to something, you increase the inflammation, the inflammatory response, further blocking the receptor, the ability of that body to be able to use that hormone. And guess what? Now you got to take more of the same thing, and pretty soon it even works less effectively. And that whole HPTA axis is kind of doomed to failure. So we're going to talk about this and get into this a little bit more specifically. I want you to know the role of iodine, and I want you to know the role of some isoflavones and so forth, and I'm going to just tell you what that's all about pretty quickly. But we need to know that these things are fixable, and then this will tie in, it'll tandem into our frankenfoods and what that really is doing to all of this. Because the mutation that occurs when we screw around with our food chain, when we mess it up, has a profound effect on our health. When our structural system isn't working the way it's supposed to, there's no triggering mechanism to tell the body what to do. And when we're stressed, you dramatically increase your inflammation. So don't go away. We have to take a break for some very important information. People who pay for Dr. Tom Roselle Live. And I'm going to come back and we're going to get into this intimately. This is Dr. Tom Roselle.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the Bowtie Cinema 11 at Reston Town Center on Sunday, March 23rd at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back to a beautiful Washington day. It's absolutely stunning outside. Hopefully you get a chance to get out for a walk and go drive a little bit. That's after you listen to Dr. Tom Roselle Live. And, you know, before that you have to sit here and pay attention, or at least turn the radio on and bring your cell phone so you can call me. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We're playing with a couple, but I want to re-invite you. What's that? I want to re-invite you this Wednesday evening, the 12th of March, 7:30 p.m. We're going to rehold Dr. Lamp's presentation, Dr. Scott Lamp's presentation on arthritis. Why? Because last week we got, weathered out a little bit, and, those of you who were in the outside areas still couldn't get in very easily, so we want to give you another opportunity to do that. If you really want to know about the intimacies of arthritic conditions, rheumatoid, gouts, osteoarthritic, degenerative disease, arthritis, and so forth, this is an opportunity for you to figure out how to get off the drugs or how to stop the progression before it goes into advanced stenosis and you lose your disc spaces and so forth. Join us, really, seriously. You're going to be amazed at what can be done. He's going to give you some dietary tips. He's going to give you some exercise tips. 703-698-7117. That's 703-698-7117. That's how you make reservations. We do require reservations, although these classes are always a gift to the community. There's no charge for them. Why do we do that? Very simply, because we want to educate you. Part of our mission at the Roselle Center for Healing is simply to give you, to empower you, the tools, the opportunity to be able to take care of yourself. And this is one of those opportunities. Join us. No charge, just a reservation. 703-698-7117. This Tuesday the 12th, 7:30 p.m., he's going to be talking about arthritic problems, and, if you're on all these ugly medications, find out how you can get off of it. I mean, it doesn't make any difference what it is. How about a little article out of in July 2012 out of the British Medical Journal that said that women who have moderate consumption of alcohol, and they were talking about wine and things of that nature, have 50% lower risk of developing rheumatoid arthritis than women who don't, who's never drank whatsoever. Now, we're not talking about drinking, 2-3 glasses of wine a day or 2-3 drinks a day. They're talking about 2 to 3 glasses a week. A week, that's all. And you don't even have to do that because there's components in that. And the study was done over 10 years and thousands of people. And so they got some really interesting data on this. So, researchers warn that no research has yet been done on women who are very, very heavy drinkers. Well, in our clinic, what we've noticed is that the opposite is true, too. People who are very heavy drinkers increase their inflammatory response and swell the joint spaces. So there's this in-between stage. Why don't you find out what that's all about and give us a call. 703-698-7117. Talking about thyroid problems, we're talking about that HPTA axis, hypothalamus, pituitary, thyroid, adrenal, or we can call it HPAT axis, which is kind of better because that's really the way it works. The adrenal glands stimulate the brain, the hypothalamus center, this little conductor, this orchestrator, which stimulates the pituitary, which releases hormones. What's the hormone that the pituitary releases as a result, or that relates to thyroid function? TSH, thyroid stimulating hormone. And we said that, if there's increased levels of PCBs and PBDEs, and PCB is simply polychlorinated biphenyls, and PBDEs, it's tough to get it out of the mouth. If I can't say it, I don't expect you to know it either. Just, that you heard it here. And those are polybrominated diphenyl esters, and they come from your foods, it comes from your environment, it comes from that type of nasty chemical loop. And so, for example, there's an interesting example. Ginseng is an isoflavone, and it's one of those things that can inhibit the TPO, the thyroid antibody. And so when you're using ginseng, and there are many different types of ginseng, it can also inhibit thyroid binding hormone. And I won't even tell you what that is. It's basically, it's called transthyretin. Got to get it out. Transthyretin. And, what happens, it gives you an estrogenic effect. So we have to have a way to modulate that and break that down. We're going to talk about that. But thyroid hormone is dependent on the availability of a place to link up. It's called receptor site. And it depends on the thyroid's ability to be able to produce certain hormones naturally. And if you have things that are blocking that, and that's, by the way, that can be a halide. It can block the ability of the thyroid itself to work, or the receptor site to be able to get the hormone that it's producing. I know it's complicated, but it actually, if you were in front of me and I put it up on a board and I drew arrows and I showed you how it worked and we forgot about all the names, you'd get it. And a few weeks ago we talked about bromides and their halides, and it used to be, an iodine preservative and yada yada. We're going to talk about that when we come back from the news. But anyway, we've got to take a break. I'm going to make this much more simple than what it sounds. I promise you. In the meantime, 888-630-9625. Give me a call. We'll be right back. Don't go away.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. We're talking about thyroid problems today and what happens, because of exposures and things that you don't know about and how they don't fix them and so forth. But we're going to go to the phones because I don't want to ignore your calls, and we'll get back to this and give you a little bit more information. But I want to remind you, March 12th, this Wednesday evening, 7:30 p.m., Dr. Scott Lamp is going to be representing his arthritic lecture, Arthritis, No Matter What It Is, and you name it, he's going to talk about it. So please join him, and the reason we're redoing it is because of the weather last week. So give our office a call at 703-698-7117, 703-698-7117. Josie, thank you for calling from Richmond. Appreciate it.
Hi, Tom. How are you? I listen to you all the time, and I'm calling about the fact that I'm 76, and all my contemporaries have low thyroid. And a lot of us think that it is the fluorides in the water that depresses our endocrine system, and also because they are telling me, even holistic people, and I'm very holistic, and I don't take any drugs, and I don't want to take a pill that I have to take the rest of my life, and I'm wondering if you know of any stem cells that will maybe make the thyroid better.
Well, actually,
I'm trying to stay away from fluorides, but I'm wondering if you could educate the people about the fact that we need to call our legislators, because unless whole groups of us are calling about this, and I'm the only one, or very few of us, it never happens. They never change the law.
Well, the thing that you have to
dumping the fluorides in the water.
Josie, what you got to remember is all this is money driven, and the fight has been going on for decades.
Yes.
There was a guy by the name of Myron Baker many years ago back in New York that led the fight against what they were putting into the water, not only affecting thyroid but also causing heart disease, because anytime you get the fluoride and the chlorines in the water, they bind in the cardiac tissue, the muscle fibrils, and they begin to break it down. But to your point specifically about the water is very significant. The main chemicals that are really of concern in all of this is called perchlorates. and and something called nitrates as well. But thiocyanate in the blood originates from a lot of different things, chemical pollutions and smoking and ingestion of certain foods, and they're also more and more, unfortunately, found in groundwater, and they're very difficult to get out. Perchlorates they're manufactured in the United States and most North American countries, including Canada, and they're used in the construction of things like highways and automotive, even restraint systems, if you will, explosives, firecrackers, fireworks. When they go out and do construction and they break up different type of stone quarries and so forth, that stuff flares on highways, and it goes on. And even batteries, just general use batteries. The environmental stability of these perchlorates, if you will, is widespread in contaminating the water and irrigation systems and so forth. So if you get them in your garden water, if you get them in your drinking water, all of these things end up causing significant receptor site incompatibility, but also inflammatory responses throughout the body in many different organ systems. So when you get these things in, they block the ability of the thyroid to use things like iodine and tyrosine and trace minerals, which actually produces the hormone thyroxine, which is T4. And then you've got thyroid peroxidases, which are, you measure those for antibody levels. What happens is they also affect iron and iron transport in the body. So many different things take place. A little while ago I talked about something called isoflavones. And isoflavones are a polyphenol substance that has an estrogen-like effect on the body, and that's another reason what you're seeing is high levels of cancers, both in men and women, prostate cancer and breast cancer. So, yeah, you're right on target, but it's much more widespread than what you're indicating.
And I do have a sticky heart valve, so there we go with that on the heart. Do we have any kind of stem cell that can overcome it?
No.
And by the way, when we take a shower, do you know that we get the molecules of the fluorides are so small they go right into the...
Well, it's not only that, it's worse because the shower water is heated, and any time the water is heated, you end up with the gases that are formed. They're much more dangerous to the brain tissue and the neurological system and so forth. But it's a subject actually we can get on for a long time. But the best thing that you can do is you've got to eat organic. You've got to filter your water. We have a double filtering system on our house, and that's the only water that I drink. And I
do all that, but when you go out to eat, you have some iced tea or soup or something. There you are.
Yeah, well, when I go out to eat, the only water that I drink is a filtered water, if that restaurant has a filtering system, or I drink it out of a glass bottle. But, Josie, thank you for a call. I appreciate it very much. Got to get on a little bit, but you're right on target. I mean, absolutely. The water system is not good. Linda, thank you for calling. How can I help you?
Hi. I lived in Virginia. I have two friends about my age, 66. One's a female, one's a male. They both, maybe 5 or 6 years ago at different times, started suffering from really unremitting pain in the vaginal area, both a male and a female. And they have gone to every doctor, done everything, taken every treatment with no results. And like the woman sits on ice packs all the time.
First thing that you look at, Linda, I mean, it's a wide open subject, and it's an area that we would have to figure out, what the status of the chemistry of the body is, if there's any underlying mold and fungus. One of the primary things that will cause vaginal burning and prostate burning, urethral burning in the male, is the presence of mold that has gotten into the tissue, and sometimes it's not identifiable on culture unless they're really looking for it, and you have to identify it. We do it through other processes and neuromuscle testing and so forth. That's one. Number two, if the person is dehydrated. Now, this is broad brush, and I'd have to know a lot more about you and these other people, but if the patient is dehydrated, then any residual bacterium, viral patterns, toxins, metals, things like that are going to have a hard time getting through the urinary tract and in the urethra or into the vaginal area. But because it's a vaginal burning, in the case of a female, I'm going to tend to think that, one, there's an acid level that is too high, and secondly, that there's a presence in the tissue of of mold. The other thing that will cause it is a tremendous imbalance in hormones. Estrogen, progesterone, testosterone levels are way off. Those things will cause the problem. Can they be fixed? Yes, but you have to treat the cause, not treat the symptom. You can treat the symptoms all day long. Dietary changes, low energy light laser, acupuncture, detoxification, those things can make a difference, but you also have to know what the hormone levels are. Linda, thank you for your phone call. I appreciate it. It's another subject that we could get into, but I'd have to know much more. But that's a broad brush. Those are things that can do that. And it's unfortunate that in traditional allopathic medicine, we treat symptoms. We don't treat the underlying problem. And you really have to understand the biochemistry, the balance that's within there. The pH of the mouth, the saliva. If you just want a quick test to find out if you're anywhere near where you need to be, go buy a pH test strip at the drugstore, and over a period of about 7 days, take your saliva pH the same time every day, generally in the morning when you wake up. Don't brush your teeth, don't drink any water, just put it in your mouth. Your pH should be 7.3 approximately, 7.23, 7.35 in there. If it's not that, if it's way too low, if it's acidic, if it's under 7, and it does that habitually, that tells you that your body is acidic and you're fighting a lot of things. If you're dehydrated, you know that. If you're not drinking at least 8 ounces of water about 8 to 10 times a day, then you're probably dehydrated. Most people in this society are. If you're drinking coffee and teas and you're not drinking water, you're dehydrated. If you're being exposed to things that have a lot of plastics or the PCBs that we've talked about, or PBDEs that we've talked about, all of those things also will change the chemistry in the body. This has, we're talking about thyroid problems today, but the effect is far-reaching in multiple systems. And we're just, we're taking one piece of the puzzle. That's why I said you can't just look at the thyroid. You have to look at the hypothalamus, the pituitary, the adrenal, thyroid axis, and then ask the question, why is it broken down to begin with? What exposures, what neurology, what stress patterns are there that are causing the system not to work the way it's supposed to? In the situation that we just talked about in the last caller with the perchlorates that are in our drinking water and so forth, if there's a lot of underground perchlorates or exposures or the smells of a new car, which are bromides, it's a halide, those things can cause inflammatory responses anywhere in the body, including the vaginal area, including the prostate. Men and women are having more problems with prostate and breast tissue today because of the environmental estrogens. We just talked about the isoflavones, which, they have an estrogen or they exert an estrogen-like effect in the body. These isoflavones are what we call polyphenolic compounds, which we talked polyphenols a minute ago, and again, that's what they do. And subsequently, they inhibit peroxidase within the body, and they do all kinds of damage. Anyway, it's like what came first, the chicken or the egg? It's not okay. Let's go to the phones. Josephine, how can I help you? Thank you for calling. Josephine.
Yes.
Hi, Dr. Roselle. How can I help you?
Hi, Dr. Roselle. I'm calling about my sister who's been diagnosed with very serious anemia, and evidently it has something to do with the kidney and the bone marrow not producing enough red blood cells, and they put her on something, I think it's something like Araness shots, and I wondered if you could throw any light on this subject. I'm very concerned about her.
How long ago did she come up with it?
She's had this for several months, I would say. Okay.
So, with that type of thing, the problem, she's not on any kind of dialysis or never have been on any kind of dialysis, is she?
No.
All right. So what she's getting is, if it's a bone marrow problem, then what we're getting is an effect secondarily to the kidney. It's not primary as a kidney problem. Anemia is common with people who have kidney disease,
yeah.
And the healthy kidneys help stimulate red blood cell production in the body. So if the kidneys aren't working the way they're supposed to, then you're going to have an increased risk of anemic problems. So, people, we're going back to people who have potential kidney disease, and sometimes it's an underlying problem with the kidney. It's not straight up. It's not blatant. And where they're functioning properly, the kidneys produce a hormone called erythropoietin, and it's referred to EPO. And what that's all about, it's necessary. Without that, you can't produce red blood cells. And so once it's produced by the kidneys, it stimulates the bone. So it's from kidney to bone. That's the issue, okay? To make your red blood cells, because your red blood cells come from the bone. So anemia, can also be caused by iron deficiency, but we're talking about a kidney situation here. So depending on the kidney problem and what the stage is, it depends on how you treat it. So from our point of view, treating symptomatically, you would dramatically increase B12 folic acid at very high levels, 5 parts folic acid, 2 part B12, but it needs to be done with somebody who really knows what they're doing. I'm not telling you to do this right now. Diet has to be careful. Actually, protein levels have to get really low. There's certain vegetable levels that have to get very high. But you're trying to get the kidney to heal. Acupuncture and low-energy light laser and dietary changes can make a huge difference. The nerves from the lower portion of the thoracic spine, meaning the area where the rib cage is, where it ends, and the upper portion of the lumbar spine, the low back, which is where it's a transition point between where the ribs are and the low back. That's where the nerves come from that go to the kidneys. And if that area is not working the way it's supposed to, then neurologically the kidney can't work. So you have to look at everything. You look at, and then you look at the dietary patterns. So we want to make sure that protein levels are relatively low, that they don't come from animal products. We get most of our proteins with a kidney patient with vegetables. And so there's a lot of different things, but it's starting with the kidney. And even though she may not have been diagnosed with frank kidney disease, her kidney's not working the way it's supposed to, and that's where the problem's coming from.
And what about these shots that she's getting, Aranes? Something? That's traditional medical treatment, and we don't deal with that. Again, depending on what her kidney status is, what her kidney filtration is, what the different enzymes are that the kidney is responsible for, would tell me whether or not there would be a good cooperative treatment. Meaning treating with the things that we talked about, or standalone treatment. But I'd have to see all those things. Could she call and see you?
Anytime. We're there. She could start with our nutrition department. She can start with the acupuncture department. She can start with me. So, yes. Josephine, thank you. I hope that we can be helpful to you and your sister. It's one of those things that you have to look at what's really taking place. We've, co-treated with for kidney patients with many other physicians, and when you do the right thing, the body has a tremendous capacity of turning itself around. It's amazing. The problem is that we ignore the why is that, and we go directly to the treatment of symptoms, and subsequently what happens is we block what actually needs to take place, and the body struggles and gets worse over time. It really doesn't do anything, and we can go on with drug after drug, and I can tell you how they work, but not the time or the place. We've got to take a break. Don't go away. You're listening to Dr. Tom Roselle Live. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Been in studio, same time, same place, every week, Sundays, 12 noon. Tell your friends. Love to talk to you on any subject, always, whether it's here during the program or, send me a note and we'll get back to you. How you do that, you go to drtomroselle.com or rosellecare.com. That's ROSELLECARE.com. rosellecare.com. Don't forget, this Wednesday evening, the 12th of March, Dr. Scott Lamp, one of my best colleagues in the practice, is going to present a evening on arthritis. So if you have degenerative changes, you have gout, you have rheumatoid, and you want to know how to get around this thing without the depletion of some of the medications that I know that you're taking, this is an opportunity to get the skinny on it, to really understand what's happening. Call us at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there, that you'd like to be with them and find out what's going on. Remember, these programs are our gift to you. Take advantage of them. Show up. We're here to educate you. I want to empower you. That's why I wrote my book, Ageless Health. Health is a do-it-yourself program, because it is. It's all about you. It's about how you take care of yourself, the things that you do that you need to do a lot of, and things that you don't do that you need to do a lot of, and, things that you're doing that aren't so hot for you. Well, guess what? Don't ignore your body. Do what's necessary. And, you have to change. There was a woman years ago, Kathy Buckley, and she's a stand-up deaf comic. Some of you may know who she is. And she was diagnosed with stage 4 metastatic cancer, and they gave her less than 6 months to live. And they told her, there's nothing we can do for you, and, go do your will, and so forth and so on. Well, Kathy, at that moment, as she told her story on stage, she said, "Who gives you the right to tell me I'm going to die? I don't think so." And she changed her attitude, she changed her mind, and she changed her dietary patterns, and she did all kinds of things. And without medical intervention, without drugs, without chemotherapeutics, without any of that stuff, and she goes back to the doc 6 months later, and she's good. So there's no sign of the cancer. I met Kathy 10 years after that diagnosis. So, see, your body has tremendous capacity to turn itself around. You just have to be willing to take the action steps that are necessary to do that. And so many of you are stuck. You're stuck in a rut. You don't want to change. You don't want to do things every day that you need to do. And, it's all individualistic. We can broad brush everything and say, if you have, a glass of wine once or twice a week, it's not going to be a big deal, or 3 times. And for some people, that's great. But there's other sources. And for some of you, that's not a good idea. It's not a good choice. There's other things that you can do better than that. Take this aspirin for your normal headache. Well, guess what? There are no normal headaches. Things don't work that way. You can have all kinds of degenerative diseases and problems and cancers and things like that, and you can always do something to make it easier for yourself and to make yourself stronger along the path. It starts with what lies between your ears. It ends up with the action steps that you take, how you change your chemistry, how you do your neurology, how you keep the energetics at a very, very high level. We're always there to help you figure that out. And, come on in anytime. We'd love to be your leader, your teacher, your director on how to change virtually anything and make it easier. And if you can't fix it 100%, how about getting to the place where you extend your timeline at a very high quality level? It all can be done. Just remember, health is a do-it-yourself program. And on that note, I want to also invite you to the Bowtie Center in Reston on March the 23rd, Sunday at 2 o'clock. It'll be directly after Dr. Tom Roselle Live, and we're going to be showing you Ageless Health, the TV program. It was nominated for 2 Emmy Awards. I'm going to be there to introduce the program and answer your questions afterwards. Be our guest. It's not expensive. You can go online at rosellecare.com and buy a ticket and bring everybody that you know. And all of that money, every last nickel of it, goes to Caring for Others, 501c3 foundation. So not only do you get educated, but guess what? You get to deduct it. We're coming up to a break. I'll see you next week. Same old time, same old place. This is Dr. Tom Roselle. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.